The dog noticed her before the man did. That was the first thing Sergeant Wren Aldis observed when she stepped onto Ward 7C at Hargrove Medical Center on a Tuesday morning in late October. The Belgian Malinois, brindle-coated, ears sharp as radar dishes, wearing a bright orange vest that read Surface Animal, turned its dark eyes toward her the moment she pushed through the double doors. The man sitting on the hospital bed in room 714 did not look up. He was staring at the floor with the particular stillness of someone who had learned, a long time ago, that the floor was safer than whatever else might be in the room. His name was on her chart. Staff Sergeant Owen Harker, U.S. Army, retired, 44 years old. 2 tours in Afghanistan, 1 in Iraq. Admitted 72 hours ago after a neighbor called emergency services when she heard breaking glass and then nothing. No voice, no footsteps, just silence, which she said was somehow worse. The intake note said he had refused a psychiatric evaluation, refused vitals, refused the meal tray, refused twice to let anyone approach the dog. Wren had been a nurse on the behavioral health unit for 6 years. She had worked with combat veterans before. She understood, in a clinical sense, what PTSD looked like when it came through those doors, wearing desert boots and a 1,000-yard stare. But understanding something clinically and knowing what to do in the first 30 seconds of a room you've just entered, those were 2 completely different things. She stopped in the doorway. The dog tracked her. The man did not move. Wren did not move either. She stood there for what felt like a very long time, holding her clipboard at her side, not raising it, not clicking her pen, not doing any of the things that said, "I am here to assess you." She just stood still the way the man was still, because some part of her instinct said, "Match the energy in the room before you try to change it." After almost a full minute, the Malinois lowered its chin half an inch. Not submission. More like acknowledgement. Wren stepped inside. She did not go to the bedside. She pulled the chair from the far corner of the room, the one farthest from the door, farthest from the window, and she sat down with her clipboard face down in her lap. She let the silence settle back over the room like it had been there before she arrived and would be there after she left. "I'm not going to ask you anything," she said. Owen Harker's eyes moved, not to her face. To her hands, checking for a needle, she realized. For a syringe, for a medication cup, for any of the 100 things that had probably already been forced on him in the past 3 days under the guise of care. "I'm just going to sit here for a few minutes," Wren said. "You don't have to talk." He went back to looking at the floor. The dog, whose name she would learn later was Compass, watched her the entire time. She found the incident report on her 4th day on his case. She hadn't been looking for it exactly. She'd been going through his chart trying to understand why his sleep logs were blank. The night staff was supposed to record observations every 2 hours, and 3 of the 6 overnight slots were empty. When she clicked into the attached documentation and found a form she didn't recognize. Not a standard Hargrove form, a transfer request filed by Dr. Gordon Pressler, the unit's medical director. Filed the previous Thursday, 48 hours after Owen's admission. The request was to transfer Owen Harker to the locked psychiatric ward on the 4th floor. The reason given, patient exhibiting aggressive and unpredictable behavior, potential danger to staff and other patients, animal on premises creating contamination and liability risk. Wren read it twice. Then she read it a 3rd time, slowly, because something in the language snagged on her the way a loose thread catches a finger. Animal on premises creating contamination and liability risk. She set down her coffee. She pulled up the federal ADA guidelines on her hospital computer. The ones she'd had to recite from memory when she'd applied for this position, the ones that were printed on a laminated card, still stuck to the break room refrigerator. And she read through the section on service animals in medical facilities. A hospital could ask 2 things. Is this a service animal required because of a disability? And what work or task has the dog been trained to perform? A hospital could not exclude a service animal from patient care areas based on allergy concerns of other patients or staff unless it posed a direct threat, and even then, the facility was required to make reasonable accommodations before moving to exclusion. Dr. Pressler's form did not mention a direct threat assessment. It did not mention any attempt at accommodation. It mentioned liability and contamination, which were not, under federal law, sufficient grounds. Wren sat back in her chair. She thought about Owen Harker in room 714, staring at the floor. She thought about the way Compass had watched her, alert and controlled and doing exactly what he was trained to do, which was stay close to a man whose nervous system could not always tell the difference between Kandahar and Ohio. She thought about the transfer request, about what the locked ward looked like, the fourth floor, where she'd floated twice in her first year and had never floated again if she could help it. About whether Compass would be allowed to follow him there. She already knew the answer. She went to her charge nurse first. That was the right thing to do. That was protocol. Margaret Abbott had been running the behavioral health floor at Hargrove for 19 years, and she had the particular energy of someone who had seen every crisis there was and had survived all of them by being very calm and very precise. She listened to Wren without interrupting. She looked at the transfer request. She turned it over once like she was checking the back for something Wren had missed. "Gordon filed this," Margaret said. "Thursday. I only found it today because the chart flag wasn't set correctly." Margaret handed it back. "I'll talk to him." "The ADA language is pretty clear," Wren said. "He didn't document a direct threat assessment. He didn't document any accommodation attempts. If this transfer goes through and it comes out later that we didn't follow proper procedure, I said I'll talk to him, Aldous." The conversation Wren had been hoping for did not happen that day, or the next. On Friday, she came in for her shift and found a note in her mailbox, a printed email forwarded by Margaret from Dr. Pressler's administrative assistant. The transfer was scheduled for the following Monday. The service animal, the note said, would need to be picked up by a designated contact prior to transfer, as animals were not permitted in the secure psychiatric unit per facility policy. Per facility policy. Not per federal law, per facility policy. Wren folded the paper twice and put it in her scrubs pocket. She went and did her morning rounds. She checked on the patient in 708 who was coming off a medication adjustment. She sat with the woman in 711 who cried every morning at 9 and needed someone to just be present while she did. She restocked the supply cart in the corridor, and then she went back to her station, opened a new document on her computer, and began writing. She wrote for 3 hours that afternoon on her lunch break, and then again at home that night until past midnight. It wasn't a complaint, exactly. It was more like a record. She went back through Owen Harker's chart, and she documented, timestamp by timestamp, every interaction she could verify. She noted the missing overnight observations. She noted that no direct threat assessment had been completed prior to the transfer request, contrary to the hospital's own behavioral health intake protocol. She had pulled that document too and highlighted the relevant section. She noted the 2 previous instances during Owen's admission where staff had attempted to remove Compass from the room without medical authorization, without patient consent, and without documented clinical justification. She documented the moment on day 2 when a staff member, unnamed in the chart, identified only by badge number in the security log, had grabbed Compass's vest handle while Owen was in the corridor and attempted to lead the dog toward the elevator. She documented that Owen had placed himself physically between the staff member and his dog. She documented that this interaction had been described in a subsequent staff note as aggressive patient behavior, with no mention of what precipitated it. She looked at that note for a long time. Then she printed everything, put it in a folder, and drove to the VA outreach office on Clement Street at 7 the following morning, Saturday, and slid it through the mail slot addressed to the patient advocacy coordinator whose name she'd found on their website. She didn't tell anyone she'd done it. She wasn't sure yet what she'd set in motion. She only knew that when she drove home in the gray morning light, she felt, for the first time in the past week, like she had done something rather than nothing. Monday came. She arrived early. She went directly to 714. Owen was sitting in the same position she'd found him in on her first day. Back straight, feet flat on the floor, Compass pressed against his left leg. But something was different. He was watching the door. Had been watching it, she thought, for a while. "I heard," he said. It was the most he had spoken to her directly, or to anyone on the unit in the 11 days since his admission. Wren set her bag down. She sat in the same chair she always sat in, the one from the far corner. "I know," she said. "They're going to take him. I'm working on it." He looked at her then, actually looked at her, the way he hadn't since she'd walked in on day 1. His eyes were dark and exhausted, and carrying something so heavy she felt the weight of it from across the room. Nobody works on things like this, he said. It wasn't accusatory. It was just a statement of what his experience had taught him was true. I know, Wren said. But I am. Compass put his chin on Owen's knee. Owen put his hand on Compass's head and didn't say anything else. The transfer was supposed to happen at 10. At 9:40, two people Wren had never seen before appeared on the unit, a man in a gray suit and a woman in a Hargrove administration badge, both of them moving with the particular urgency of people who have just been handed an unexpected problem. They went directly to Margaret's office. The door closed. Wren kept doing her rounds. At 10:15, Dr. Pressler appeared. He walked past the nursing station without looking at anyone and knocked on Margaret's door and went inside. The door stayed closed for 37 minutes. Wren knew because she watched the clock on the corridor wall. At 10:52, Margaret came to the nursing station. "Transfer is on hold," she said. Wren finished typing her note before she responded. "Okay, Gordon wants to speak with you. I'm available after my shift." Margaret gave her a look that Wren couldn't fully decode. Not quite anger, not quite something else. This came from above him, Aldous. The patient advocacy office called the patient rights coordinator, and apparently there's now a formal review. "That's appropriate," Wren said. "There were procedural issues. You could have come to me. I did come to you." Margaret was quiet for a moment, then she said, "Yes, you did." She went back to her office. Wren went back to her rounds. The formal review took 11 days. In that time, Wren was called into 3 separate meetings. One with Dr. Pressler, one with the hospital's compliance officer, and one with a woman from the Office of Civil Rights at the regional VA who had driven 4 hours to be there and who asked questions with the quiet precision of someone who had done this before and had not always liked what she found. Wren answered every question directly. She brought her documentation to each meeting. She said the same things each time, in the same order, because the truth doesn't require variations. In the second meeting, Dr. Pressler said that his transfer request had followed standard institutional practice for managing behavioral health patients who posed liability concerns. The compliance officer said, "Can you point me to the section of the ADA Service Animal Guidelines that permits exclusion based on liability concerns?" Dr. Pressler said he would need to review the documentation. The compliance officer said she would give him time to do that. In the third meeting, the woman from the VA's Office of Civil Rights set a folder on the table and said, without preamble, "This isn't an isolated incident." She said it the way someone says something they have been waiting to say for longer than just this case. She laid out documentation, not from Wren's file, from the facility's own records, showing 3 prior instances over the past 2 years in which service animals accompanying veteran patients had been excluded from care areas at Hargrove Medical Center. 2 of those patients had filed informal complaints that had been closed without review. One had simply been transferred. "Sergeant Harker's situation is notable," the woman said, "because someone here followed proper protocol. Nurse Aldous documented correctly, escalated appropriately, and referred to the correct regulatory authority within the required time frame." She looked at Wren as she said it, and Wren looked back and felt something she didn't have a word for. Not pride exactly, not relief exactly. Something more like, this is what it looks like when the thing is supposed to happen actually happens. Dr. Pressler's transfer order was rescinded formally on a Thursday. His service record was flagged for review. 2 other members of the unit staff whose incident reports had contributed to the documentation against Owen received written disciplinary notices. The facility announced 60 days later that it would be implementing mandatory trauma-informed care training for all staff working with veteran patients. It also announced a formal partnership with a regional VA facility to provide co-consultation on veteran admissions. Owen Harker stayed on 7C for another 3 weeks after the transfer order was withdrawn. In that time, he began to talk. Not a lot, not about everything. Not in the way that movies like to show, no single cathartic night, no sudden unlocking. It was slower than that. More like a door that's been painted shut and you have to work the frame a little bit every day before it moves at all. He talked about Compass first. That was always where he started, because Compass was safe ground, had been safe ground since the day they'd been paired together at a program in Colorado. 2 years after Owen came home, when Owen still hadn't been able to sleep more than 90 minutes at a stretch and had lost 40 pounds and had come very close, on 2 separate occasions, to not being there at all. "He knows when it starts," Owen said one afternoon. They were sitting in the small sunroom at the end of the unit. Wren had requested access for him after the second week, and Margaret had approved it without comment. Compass was lying across Owen's feet. "Before I know. He's already there, already doing the thing." "What does he do?" Wren asked. "Presses." Owen looked down at the dog. "Just presses his whole body against my legs, so I can feel the weight of something real." She wrote that in her nursing notes later. Patient reports grounding through deep pressure contact with service animal. Patient demonstrating increased verbal engagement and improved eye contact. No overnight incidents past 8 days. She did not write the part where, after he said it, she'd had to look out the window for a moment because of the particular quality of the silence in the room. He talked about his sister, who lived in Bend, Oregon, and who had been the one to send him the information about the service dog program in the first place. He talked about the things that still made him go sideways. Loud sudden sounds, certain smells, the particular quality of light at late afternoon in October, which was the same light that had been there on a day in Kunar province in 2009 that he did not describe and that she did not ask him to. He talked about the neighbor who had called 911. He said he didn't blame her. He said he understood why silence scared people, because it had taken him a long time to understand that the silence inside himself was not the same as the silence before something bad happened, and sometimes he still got them confused. He did not thank Wren directly. He wasn't the kind of man who did things directly. But one afternoon toward the end of his stay, he came to the nursing station, came there himself, which he had not done before, and he set a piece of paper on the counter. It was a drawing compass, in pencil, remarkably detailed, the tilt of the ears, the alert set of the eyes, the exact weight of the shoulder muscles, the orange vest rendered in careful cross-hatching. At the bottom, in small handwriting, Ward 7C, October-November. He was already walking back down the corridor before she picked it up. He was discharged on a Friday morning. His sister had driven from Bend 17 hours through the night and was waiting in the lobby with a thermos of coffee and the careful expression of someone who loves a person and does not always know how to show it without scaring them. Wren was not on shift that morning. She had traded with a colleague 3 days earlier without explaining why. Because she had known she would not be able to do the discharge paperwork without it meaning something that would make the paperwork harder to complete. She was better at this than she used to be, but she was not yet entirely good at it. She heard about the discharge from a colleague who texted her at 11:17 that morning. He stopped at the nurse's station, thanked people by name. The dog sat and gave his paw to everyone who came over. Wren was in her kitchen when she read it, still in the clothes she'd slept in, drinking coffee she'd made too strong. She read the text twice. Then she put her phone down on the table and looked out the kitchen window at the November morning. Gray sky, bare trees, the particular stillness of a day that hasn't decided what it wants to be yet. She thought about what the woman from the VA had said. Someone here followed proper protocol. She'd said it like it was notable, like it was unusual enough to be worth remarking on. And that was the part that stayed with Wren, not the part about the review or the policy changes or the compliance flags, but that part. That following the rules, doing the correct thing in the correct order, had been unusual enough to be worthy of comment. She had not set out to do something exceptional. She had set out to do her job. The fact that those two things had turned out to be the same thing was not something she entirely knew what to do with. She thought about Owen Harker watching the door on the morning the transfer was supposed to happen. Nobody works on things like this. Not a question. Just the sediment of every time he had trusted an institution and watched it turn away. She thought about Compass pressing his whole body against Owen's legs so he could feel the weight of something real. She thought about the drawing, which was now in a frame on her bookshelf at home, not because she'd planned to keep it, but because when she'd thought about where else it could go, she couldn't think of anywhere that made sense. 6 months later, Wren was asked to present at a hospital-wide staff training. The topic was trauma-informed care for veterans. She was not the expert. The woman from the VA's Civil Rights Office was there, and a psychologist from a veteran wellness center in the city, and a handler from the same service dog program in Colorado where Owen and Compass had been paired. Wren was asked to speak for 10 minutes about the nursing perspective. She stood at the front of the conference room and looked out at the assembled staff, nurses, physicians, technicians, administrators. And she said the thing she had been thinking about for 6 months, the thing that had started forming in the room on Ward 7C when she'd sat in the corner chair and done nothing except be still. The protocol exists, she said. Most of us know what it says. The question isn't whether people know the rules. The question is what we do in the 30 seconds before we reach for the clipboard. She paused. In those 30 seconds, we make a choice about what kind of room we're walking into, and that choice, that one, before anything is documented or assessed or formally reviewed, that's the one that matters most. The room was quiet in the way rooms get quiet when something is landing. He had a dog, she said, because he needed something that would stay. Something that couldn't be pulled away from him by policy or liability language or institutional convenience. She didn't look at Dr. Pressler, who was in the third row. She didn't need to. Our job, what we're actually here to do, is to be that thing, to be the part of the institution that stays. After the training, the handler from the Colorado program found her in the hallway. He was a compact, weathered man with the calm of someone who spent his days working with animals and the people who needed them. We have 4 dogs in the current program, he said, who don't have placements yet. Combat veterans, mostly. Some first responders. He handed her a card. If Hargrove ever wanted to establish a formal service animal integration protocol for veteran admissions, we'd be glad to consult. Wren took the card. She was already thinking about who to call first.